So just to kick things off, it'd be great if you could walk us through a little bit about your career journey and what brought you into the biotech industry.
Yeah, sure, Nikki. Look, and I'll try and make this as short as and engaging as possible. So let me start off with saying I'm not a doctor. I'm not a scientist. I've got an accounting degree with a legal background. I started my career in professional services, and I spent 23 years as a partner at Deloitte, and 9 of those years as a member of the Deloitte Australia board. During that period of time, I was engaged with and led a number of businesses that helped Australian and international companies really focus on their R&D programs, both nationally and internationally. And I also did a lot of work on innovation policy design here in Australia, and did a lot of work with government, obviously state and federal. During that process, through my clients and also through my work with government, I got a lot close to Oz Biotech, and I was invited to join the Oz Biotech board, and I served as a director of Oz Biotech for 9 years. And it's really during that process that two things were happening. One was that I was starting to really understand the Australian life sciences and biotech sector, how it's designed, its advantages, some of the challenges it deals with, and in that sector also work with many companies, large and small. So that's how I got a taste and an interest in the sector. There's another thing, just from a very personal perspective. I'm a highly purposed individual, and I've had some significant health challenges in the past. So I like to work with companies that, at their core, are trying to solve real problems for people, and in health. So that obviously drives me as an individual as well as a professional. So that's how I got involved in the sector.
I just want to say, Sergio, just hearing that, it's really humbling and intimidating. And to reflect back on a few months ago when I joined PharmOst and our first conversation, I remember I was so nervous talking to you. When I saw your background, I found it so intimidating. But I have to say how welcomed you've made me feel, and you continue to make me feel. And it's a real privilege to get to work with such a collaborative chairman and board. And it just speaks so highly of just the whole team. It's just a great experience so far. So I just wanted to really stress that point. So thank you for that.
Thank you. Thank you. Look, it has been a lot of fun. It's been a lot of hard work. If we look back over how much has been achieved since this new board and executive team really came together in early May, mid-May, there's been a lot of hard work, but I have to say I've thoroughly enjoyed it as well, working with you and the rest of the team.
Having that different background, I think people assume that if you've got like the perfect background and the technical knowledge, that it's a benefit. But I actually think sometimes the opposite can be even more true, because you come in asking those different questions that maybe those of us who are in the know would take for granted, and we don't even think to question those things. So I think it's great for us to have you on board for many reasons, but that's one. It'd be great to understand what attracted you to join the company, and what made you or helped you make that decision to accept the role.
I need to give you just a little bit of background so it makes the choice a little bit more, you can understand the choice. So I retired from Deloitte in September 2021. I had a second bout with cancer, and it was during COVID, and I promised myself if I got through it, I would do something different. I loved the firm that I worked at for 23 years, but I couldn't really do the 50 hours a week, and I felt a little bit diminished. So I promised myself to retire. So I retired in September 21. I took a year off. I took a year off to do a number of things. One was to get healthy again, and thankfully I am. Another was to spend time with my family and do some traveling. And the final thing was really to say, okay, you're nearly 60, in your third act, where do you want to spend your time, and where do you think that you could deliver the most value given your experience, your connections, my networks, and all that I am at that age. And so I decided back then, during that 12-month period, to start to pursue a role on boards, so the non-executive director role. It wasn't that I wanted to play golf and, just not work full time, but I really felt that at that point in time, I didn't want to be a CEO. And at that point in time, I actually felt that I could deliver value as a non-executive director and potentially as a chair. So I started on that, and I was put on a board of a small biotech. I won't mention the names. That was going really, really well. Then I got on a board of another I'll call it a health technology company, and I was thoroughly enjoying that. Appointed to a couple of government boards that are involved with Australian innovation policy, which was sort of in my sweet spot and skill set given my experience. And I was sort of pretty comfortable, really enjoying it, understanding how different the contribution is as a director as opposed to an executive. And it's very different. I had that experience at Deloitte, so I understood what it was like to be a director as opposed to an executive, and I thoroughly enjoyed that. And I felt that I had something to give. So when the opportunity presented itself completely, I suppose I wasn't looking at all. I was actually planning to go overseas. And about 4 weeks before that, this opportunity presented itself. So initially I thought, well, that's very interesting. Let me find out and understand a little bit more about the company, about the existing board, understand assets, what intellectual property it owns, what is it trying to do. And if these things all aligned with my purpose and I felt that I could bring something, I'd pursue it. So the main reason when I did some research was that I saw that Pharmost had a really interesting portfolio of IP assets. Also, in conversation with an existing director, I understood that there was a desire to try and deliver value in MND and ALS with Monopantol as its primary therapeutic asset. So I did as much research as I could about that, and I started to understand how significant of an issue it is here in Australia and globally. There is a significant unmet need in terms of effective therapeutics globally. Obviously in Australia and in Melbourne, we saw the work and we see the work that Fight MND and MND Australia do. So, I think we've got an acute awareness in Melbourne of the disease, given the work that Mr. Danaher has been doing. In terms of raising awareness and raising funding. So that actually struck me at a human level. And I thought, well, if I can actually make a difference with this organisation, two things. One is it's really highly aligned to my own purpose. And also I felt at that point in time, the organisation could use my skills as a chairman to try and build a new board, construct an effective executive team, do what I do, which is not the science, but actually put in place an organisation with the right sort of governance, with the right sort of funding to really allow the science to shine. And that is to be the best it can be. No one can predict an outcome of a clinical trial, but what we can do as an organisation is put everything in place so as we have the greatest chance of success. So that's why I thought, well, this is a fantastic opportunity. I didn't expect it to be as much work as it has been. There's been a lot of work that we've had to do as a team, but that's been really enjoyable because, as you say, Nikki, I think the team has been getting on really well together. We're all driving towards a common purpose, a common outcome, a unified strategy, and we're just ticking things off and getting things done. So it's really good to be part of that sort of a culture.
There can't be many people with your particular skill set and your lived experience, having been through similar, health issues yourself. It's a really unique perspective you bring to the team. So yeah, again, we're just so lucky to have you. But for my own background as well, when all the years ago I finished a PhD in ALS, it's really hard to know unfortunately, how little has changed for people, for patients living with ALS, and how urgently we need to bring better treatments to help them enjoy more time with their family and their friends, right? That's what's the big driver for me as well, is knowing you can make that difference to people.
The patient perspective is never lost on me, having been a patient twice in this system, which is one of the reasons why I'm sort of involved with another organisation, Lymphoma Australia, and I chair that charity. And we're all about patients and their carers and empowering patients with the right information so as they can make the informed choices and also try to improve equity of access to different treatments. So, because let's face it, we are here to try and solve or improve patient outcomes. And if we are successful in doing that, clearly there'll be a great human benefit, a community benefit, and there'll also be clearly a benefit to shareholders and other stakeholders. So, there's a strong alignment as to why we're doing what we're doing and what
Absolutely. Yeah. So just talking about, now that you've kind of settled into the job for at least a few minutes here, can you share your vision for the company's future and what strategic goals you might be thinking of setting or you've set?
As a board, it's pleasing to say that we've got a very consistent shared vision. And that is, when we looked at the portfolio of our assets that had been invested in and built up over time, we felt that we needed to narrow our focus and really to make a bet. You know, strategy is about making choices. It's what to do, but equally what not to do, to define where we wanted to play and how we were going to win. And that strategic alignment meant that we were narrowing our focus less on what was done in the past, which was some veterinary applications and clearly some cancer. We're not going to turn our eye on the value that might be in that portfolio of IP assets, but we will consider that moving forward. But right here and right now, we're focused on using on advancing both from a preclinical and a clinical perspective Monopantal as a therapy for ALS. So our strategy is really to drive singly at that goal, and our recent successful fundraising, both with the institutional support and incredible support by our shareholders through the share purchase plan, has enabled us really to direct all our attention now and focus on our preclinical program and our clinical program, which obviously includes the Healy trial in the US. So our strategy really is to be an organization which is focused on developing therapies for neurodegenerative diseases, ALS being the first one, but we're not going to limit ourselves to that disease.
I suppose with your great background, having worked with Oz Biotech and being involved in healthcare in other boards, can you touch on what you see as the biggest opportunities for our company in the biotech sector, and especially if we can narrow that focus to neurodegenerative diseases as well? What do you think about our opportunities there?
Well, unfortunately, and I say this unfortunately, given the unmet need in from a therapeutic perspective for some of these diseases, the opportunity for commercial success and patient impact is significant. So from our perspective, we want to make sure that we do all we can to be a significant player in Australia and potentially globally, either in our own capacity or through strategic partnerships and alliances, to actually continue to advance the science, to advance potential therapies in the neurodegenerative space. So I think the opportunities are significant. Clearly, it's not without risk. We understand how challenging these diseases are and how challenging it can be to develop an effective therapy. What I can say, what makes me feel quite optimistic and positive, although I think I'm a realist when I talk about when I think about how things play out in life, having spent a lot of time in the biotech sector and understanding how many fantastic people work really, really hard and sometimes not get the outcomes that they seek, is that our preclinical data and our early clinical data is really encouraging, really encouraging.
Yes.
Equally, to be invited to participate on the Healy trial with Monopantal is another vote of confidence by a preeminent institution in terms of our science and the potential. So, I think the opportunity is truly are significant for our organisation, but we all need to be mindful of the risks involved in clinical.
Thank you. I think you've sort of started to answer my next question when you mentioned the Healy trial.
Yeah.
So, given the importance, obviously, of innovation in biotech, in particular, what are the upcoming projects and areas of development that get you most excited to think about? Would you like to touch on some of those?
In terms of innovation and opportunities for our organisation, look, again, Nikki, I think we've got a real opportunity when we look at the work that we're doing in terms of our preclinical program to try and understand in a deeper sense the mechanisms of action and just how Monopantal, the reach and the potential impact it has. I think that's really exciting. We're focusing on ALS, but there is a potential to look at other neurodegenerative diseases. I think that's really exciting as well. And so our R&D program and supporting that, I think, is really, really important. The work that we do here in Australia is really important in terms of that in the ecosystem to support that innovation is equally really exciting and important. But I think, and I know as a board and as executive, we really want to make sure that our innovation and R&D is pretty much focused on our core strategy and not to be not to chase every shiny bauble down the lane, which one can do. So you need to be quite disciplined in that approach to make sure that our focus and our innovation is in the right area for the right reasons.
Well, you touched on my love of all things scientific. I'm also incredibly excited about the R&D and where that leads us to as we learn more and as the time unfolds. So if we focus now perhaps unfortunately on the other side, the flip side of the coin, and on the challenges, can you speak to perhaps what you see as some of the major challenges in Australian biotech, and how might we be prepared, or how can we be prepared to overcome those wherever possible?
Yeah, well, I can answer that question from a couple of perspectives. So firstly, if I zoom out and not focus on Pharmos specifically, but the sector itself in Australia is doing okay. It's evolving. There are some incredible success stories that we all should be proud of, but there have been some sustained issues which sort of dog the sector, and I think limit it. And my work at AusBiotech, where we work extensively with government and other key stakeholders to develop 2 industry blueprints that we presented to government, which sort of said, look, here's a holistic view of the sector. Here are some of the real challenges. Here are some of the real advantages. What can we do from a policy perspective to actually try and improve those challenges? So the ones that those of us who have been in the sector for a long time, the biggest one has always been and remains is access to capital. Australian access to capital is more challenging than in other global jurisdictions. Our pools of capital tend to be shallower, and there is less money around for translational early research, and some of the structural issues around our capital base for biotech means that some organisations list a little earlier than they should in terms of their maturity. So you'll see a number of biotechs on the Australian Stock Exchange that have listed probably too soon, and they did that because there was no other way for them to raise capital. But it meant in terms of organisational maturity, they probably weren't right, which actually then hamstrings them in terms of further capital raising, which reinforces this issue. So there's a challenge there for the sector around access to capital, patient capital, capital that understands the drug development life cycle and the risks associated with it. So I think we're in that as well. We face that challenge like any other biotech and life science company. We've done okay, I would say, in terms of, and I'm very pleased with our current capital position. But you understand, and many understand, that the drug development cycle is an expensive thing to do. So, if one thinks about what one needs to effectively do a phase 2 trial and then move into phase 3, the sums of capital are significant. So Australia is obviously challenged by that. The other Australian issue that we have, for various reasons, is access to talent. I don't mean you're in the room, but if you look at the portfolio of companies and the talent and the skills that you need across the life cycle of, I suppose, activities, we've got a challenge here in Australia around. There's a skills gap. There is a talent and skills gap. So we need to be working on solving that as well. There's a challenge for Australia for companies to scale up and commercialise. You'll see, if you study the Australian biotech sector, those that are successful tend to do a deal, a license or a sale or something which actually then takes the IP out of Australia in whole or in part for further development and commercialisation activities. That's just the way it is. I think it reflects our shallow capital base and maturity, but I think that's an issue. We've got some gaps in sovereign capability. It's improved post-COVID with some investments in some, sovereign capability around manufacturing and the like, but we've still got some gaps there. The other is, again, I'm going to come in with some good news, but the other one is that what we hear is that, in terms of other jurisdictions, we're small, so therefore access to the right sort of population for phase 2 and 3 trials may be an issue from an Australian perspective. And we're also apparently expensive. So from our, vis-a-vis other jurisdictions, we can debate that, but, to do a clinical trial in Australia, notwithstanding we have highly skilled workforce, and assuming we have the right sort of population, we may be more expensive vis-a-vis other geographies. So there are a few challenges, and I know the government, both sides of politics, have been working to improve the situation for Australian biotechs and for the life science sector.
Just for my own interest, Sergio, because
Yeah.
I suppose my background is more towards the scientific part of, working in biotech. When you touched on the shallow pockets, is that because the population, or like what does that stem from, the shallow funding opportunities you said?
Well, yeah, look, one is a function of the size of our economy.
Okay.
The other is I think the structure of our venture capital, early stage funding industry. Life sciences and biotech has a sort of higher risk premium. There's a higher risk reward. So if you get it right, the rewards are greater. But typically, as you know, drug development and discovery takes a long period of time. So if you're a venture capital firm and you wanted to potentially shorten the route to return, you wouldn't be picking biotech. You might be picking software or something else where you're going to understand your route to market is going to be a lot shorter, and maybe a little less and significantly less expensive. So we've got an issue associated with that. Look, there's been lots of work done. The government's poured lots of money into the Medical Research Future Fund. That $20 billion endowment is pouring money in now into mainly preclinical research, which is really important. The university sector continues as well. Where we struggle is this translation and commercialization, taking the idea and moving it forward. That's risky, and the pools of capital supporting that activity in Australia are shallower vis-a-vis the US or Europe, and that's just a fact. Notwithstanding, we have some fantastic people and organisations like Brandon Capital that have stood up a number of funds in this space and are supporting Australian innovative life sciences and biotech companies. They're doing a great job, and there are others. I don't mean to single them out alone, but we just need more. Yeah.
Thank you. So I probably touched on it before, and one thing I've already had the pleasure of experiencing since you've taken on this role is your leadership and your leadership style and your collaborative approach, which I can't speak highly enough of. Can you perhaps walk us through the principles that guide your decision-making process as a leader, especially given, it's such a dynamic field to be working in biotech?
The first thing that I always keep at the forefront of my mind is that never assume that you are the fountain of all knowledge and the smartest person in the room. That's really dangerous. I'm acutely aware of my own capabilities and where I have real blind spots. So one of the things I've been able to do over a long period of time in multiple organizations is build a good team around me where hopefully we fill each other's blind spots, and as a team we enhance each other's capability. So for one is really about listening, being an active listener, having a high degree of self-awareness around my own limitations, and then building a team around me which together we can deliver what we decide to deliver. My leadership style, I would say, is collaborative, if you wanted to put a management term on it. So I listen a lot, and then I try to synthesize and repeat what I've heard, and then see what the consensus view in the room might be. But I then make decisions, and I try to make my decisions always based on data, as much data as you can, certainly in this particular sector where data is everything. So I would say I'm a data-driven decision maker, but with a collaborative style. I don't know if that makes sense. But that would be my process. I'm really curious, and I know that term's been utilised way too much, but I really try to understand at least how things are meant to operate, even if I don't necessarily understand the detail. And that is absolutely true, of my role here at Pharmost and on other biotech boards. I will never fake that I understand fully the science behind either why something works or the complicated pathway. That is for others who I respect, that have those skills, and I value and respect their input. I think it's also important that we have things such as scientific advisory boards where we expand the knowledge in the domain that we need, and bring that into the organization. So it's great to have dissenting voices. It's great to have, difference of opinion. I think that's where everybody learns. I'm a big believer in diversity of gender, diversity of race, of culture. That was something that I championed strongly at Deloitte, and I just think we need more female board members. We need more female leaders. It is pleasing that in our space, life sciences and biotech, there are a lot of female CEOs or a lot of female leaders compared to other industries and sectors, but we need to do more, I think.
That probably leads nicely onto the next question. I wish I had met you years ago, because I would have liked to have asked this question for my own selfish purposes, just in terms of people who are trying to get, climb up through their careers and trying to work out how to get to those next roles and how they might crack into the biotech industry and also how they might get into board roles. Do you have any words of wisdom you'd like to share?
Well, wow, that's a really broad question. And it actually depends on, okay, let me take a step back. So if I was advising someone with a technical background as opposed to a commercial background who wanted to break into life sciences, well, clearly, you've got to focus on your technical qualifications. Obviously the degree, the master's, a PhD, if that's what you want, if that's where you believe your value is, you've got to get that technical qualification. It's absolutely critical in a science and STEM-based career. I then think in order to move in and move up and move in, it's really, really important for those who come through the sciences who then end up in a commercial environment. You've got to get exposed to how commerce actually works, and it does beat to a different drum. If you just look at how the world allocates resources to certain things, you think, my God, why is it that a researcher goes from grant to grant and is doing some groundbreaking stuff, where someone who might actually be, for example, like an accountant or a lawyer, has all this relative wealth bestowed upon them vis-a-vis to those? We can't change the way the world allocates its resources. I think it's fundamentally unfair. You can make the same argument for teachers, nurses, early childhood educators. The world is what it is. So I think it's important to try and understand how you add value in this other world, which is the commerce world, as opposed to your science-based world. And they are very different. The way in which you do that is you've got to get look for some really good mentors. I was involved in a mentorship program, I think it was called IMNIS. During my time, I think I mentored 6 PhD students for a year each. We had a fantastic relationship. It truly was symbiotic insofar as I learned so much about their world and they learned a little bit about my world. That was a great program. Equally, there are organizations such as MTP Connect that have programs, the Ready program. There's the Bridge Connect or Bridge Tech program. There are a number of programs where you can actually work with them to be embedded into a commercial development program and get some commercial experience. So I think you've got to try and broaden. If you want that role, you need to access the commercial world, and there are various ways of doing that. It's the old adage, build professional networks, try to get a diversity of experiences and roles. I mean, if you're fundamentally a science or STEM-based individual, try to understand how the world of commerce actually works, and then understand the commercialization process. And so you do that again through, either mentoring, working for a commercial organization and the like. So there is no one way. You've got to find your own path, but and some individuals may not want to move into that commerce or commercial, or they may very happily stay in the very valuable role of being a researcher and providing some, fundamental and critically basic research. So that's that. But then if the question extends to how do you become a director? If you meant to, how do you get a role on a board? I think one of the first things you have to ask yourself is, why do you want to do it? Because there's a couple of things around that. There are a lot of risks associated with being a director, increasingly so, both which are legislated in the Corporations Act. There is also public perception, as it should be, to ensure that directors are accountable and doing what they need to do. So there's a real commercial and social obligation on directors, which is increasing, and as it should, because we have had a number of terrible examples in the past where directors haven't been doing the right thing or probably been a little lax in their role. So understand why you want to do it is the first thing. What do you think you can bring to the role? So be really clear about your own value proposition. What value do you think you can bring to this board and why? I think that's really important. Then I always suggest that you have to do the formal Australian Institute of Company Directors course, so you have a better understanding of the legal obligations that you're under, and the legal obligations and your fiduciary duties to the board. You need to understand that and say, does that fit with who I am and what I want to do? Because look, you're not going to be a director for the money, and I don't mean that in a flippant sense. Directors aren't poor, but the money is actually in the C-suite and the executive team, as it should be, because they're the drivers of the organisation. They drive and deliver the value. The directors have to help and ensure that we've got the right sort of strategic fit, we've got the right sort of governance, that the organisation engages with its key stakeholders, whoever they may be, shareholders, government, consumers, the team, effectively. You've got to keep everything running and make sure you've got the right checks and balances. So you've got to understand the role. And finally, how do you get the role? You can go see a professional recruiting firm and give them your CV, and they might interview you, and there's that avenue. I have found, and this is not probably a good thing for the sector, but I have found that most roles you become aware of most roles through word of mouth and through your own networks or networks of networks, and then through experience. So if someone's worked with you in the past and think that you have the right cultural fit, you might get an opportunity for an interview, and then you take it from there. Unfortunately, it does feel that it's still that personal network that actually flushes out opportunities. I don't think that's ideal. I think we're missing a lot of fantastic people who may not be connected through various reasons. So, but again, that is what it is. That's my honest assessment.
Thank you for that. I just wanted to touch on a couple of things, because these are questions I like to ask people as I get to know them, and I realise I haven't really had the opportunity to ask these kinds of questions with you, Sergio. Perhaps that's a good thing, because we've been too busy working. So he's not in the background now, but I have a gorgeous Dalmatian. His name is Banjo, who I probably talk about a lot, not with you yet, and I often look like a Lamington because he shared so much. Do you have any four-legged, two-legged, winged, tailed things in your life?
Absolutely. So, Nikki, we have a gorgeous dog called Mika. It's a spoodle, a chocolate brown spoodle. She's 14 now, and still pretty sprightly. So yeah, we adore that dog. So we have Mika.
She doesn't shed, does she then?
No, they're sort of meant to be hypoallergenic, and they don't shed, So we have Mika, and we also, we've always been, up until recently, we've always had a cat as well.
Okay.
So going back when Petra, my wife, and I first started living together and then were married, we had Burmese cats. We thought they were great. They were sort of pseudo children. And then when we had three of our own daughters, we dropped down to one cat, and then one cat and a dog. And unfortunately the cat passed away last year, so we're now down to one dog. But yeah, we've always had a pet.
Are you going to get another cat or dog?
Well, we will get another dog eventually.
Okay.
Not now. We've moved into an apartment now, so it means that dogs are great. They get you out and you walk.
They do
times a day, which is fantastic.
Yeah.
I feel that we never used to let our cat run wild, but a cat in an apartment, it sort of feels a bit. I'm sure you can do it, but it sort of felt a bit odd.
Yeah, I can understand that. And on to something else. Another favorite topic of mine is I have a thing for ice cream. Anytime I travel, I love trying new ice cream places. Am I asking someone with lactose intolerance? Is ice cream, gelato, do you have a favorite flavor?
Yeah, I do. So I have two favorite flavors. So you, whenever I'm overseas and we're to go to Italy and we go to a new town, we try and suss out which is the best gelateria in town, and we try. So I have two standard flavors that I try. They're my reference points. So the first one is Yeah, I love salted caramel, and the other one is pistachio, and I put them together, and they're an awesome
Oh,
combination. I'm also partial to really dark chocolate
okay.
as well.
Okay.
Hmm,
Let's go a bit further into this. My
yeah.
husband has a preference of even the order on which he finishes his flavors. Are you that pedantic? Do you have to
No,
always finish on the
no,
pistachio or the no?
no, that's driven by how the order that the ice cream goes in. I'm not, and I do like they. I'm not sure if they do that here in Australia. They probably do. They also put whipped cream. They put this thing called panna
Oh,
on top of the ice cream, which is sort of sweet, and it goes really
yeah.
well with salted caramel and the pistachio. So, and then they give you a little biscuit. So, yes, yes.
I probably shouldn't have asked this. I'm hungry, and asking these questions is probably not the best idea.
You've picked a perfect topic. We could talk about this for
Oh
hours.
no, I could talk. This is a very serious conversation I have with people is ice cream. And it's like thankfully I love running in a higher ratio than I love eating ice cream, so they balance each other out. One more thing, another thing that I love, it gets me through the day is it's my carrot is, are you a coffee drinker?
Oh, please, absolutely.
Okay. You say Italian, surely that'd be insulting to assume you weren't, right? Okay,
Not insulting.
what's your order of choice?
Okay, it depends again. So my my go-to in the morning will be a piccolo latte because I like a little
Yeah.
bit of milk, but I don't like a lot of milk, like a milkshake. So a piccolo latte. And then as the day progresses, I go from a piccolo latte to a macchiato, and then I end up at an espresso. So I just
Oh
take the milk
wow.
out as the day moves. And
Okay.
yeah, yeah. So that's
Okay.
typically the order. Mm.
So we are full of ourselves in Melbourne. We think that we're like this coffee capital. Are we? Like, do you think we are, or do you think it's better overseas, the coffee
Oh,
in
such a
Europe?
personal thing. I think Melbourne does have really good coffee. Really does. I think Europe is it's so it's so diverse. So Italy has great coffee, I think. I
Yes.
think France
Yes.
has terrible coffee. You cross the border and you go, what happened?
Yeah.
30 kilometers ago I was here and now I'm here. And
Yep.
the coffee's terrible. So yeah, so I think Italy has good coffee, and there's a big difference between northern Italy and southern Italy as well, I think. Yeah. So, but the way in
Why?
which you have a coffee in Italy is you stand at the bar, they give you a little glass of water, you have a really short, sharp shot of espresso, and away you go. So no cappuccino after 12 o'clock. They don't really know how to make a latte. They can make a piccolo. It's just cultural. It's just a different,
Yeah.
yeah.
Yeah. That's been fantastic. I just think I've probably taken up more than enough of your time, Sergio. It'd be great just to end up, I suppose, just to let our listeners know that this is the first of many planned sessions we have. The content will be varied. We hope to keep everyone on their toes as to what we'll be doing, and we look forward to joining you back in another 2 or 3 weeks' time. But again, Sergio, it's been wonderful getting to know you. Do you have anything else that you wanted to perhaps say
No.
before we wind up for today?
Well, Nikki, I've really enjoyed the experience. I didn't know where we were going with the
Yeah.
conversation, so that was good. But I've enjoyed the conversation, and I commend the initiative. So I'm looking forward to other conversations you have with people in
Mhm.
our organisation or in our industry, in our sector. So look, I want to say thank you for the opportunity. So I've enjoyed it as well.
No, thank you. It's been great. Thank you so much, Sergio. We'll speak to you soon.
Cheers.
Bye.
Bye.